Time for Health Watch at 8:16 this Tuesday morning. Today, the dangers of stomach reducers. Well over 100 million prescriptions for these drugs are filled each year, making it the third most popular class of prescription drugs in the U.S. But 5 new studies find that these medications, which control heartburn and acid reflux, can have serious side effects. Our Dr. Jennifer Ashton is here this morning with the details. Good morning.
Good morning, Maggie.
So what are some common names of these drugs so people are clear on what we're talking about?
So they're the class known as proton pump inhibitors, and they go by the names of Nexium, Prilosec, Prevacid. Generally very safe and well tolerated, but like any medication, whether it's prescription or over the counter, can have some side effects.
So we're talking about both prescription and over the counter?
Right, and the side effects that they found basically were things like headache and nausea, which again can occur with a variety of medications, usually not serious, but then they found an increased risk of fractures, specifically of the spine and wrist. That was 25% increase, especially in postmenopausal women, and an increased risk of certain types of bacterial infections. The thinking of there, Maggie, is that these acid reducers can kill off the acid in the stomach, which then allows an overgrowth of bacteria and then could lead to these bacterial infections.
Are these side effects, especially the more serious one like the fractures and the bacterial infection, common or rare?
Well, there's so many people on these medications that, again, the denominator is so great that the number of these side effects can be significant.
But this is only with prolonged use, not if you take them once
again,
in a while.
this is not for the occasional use. This is for people who are on these medications daily and stay on them indefinitely.
And the reason so many people are on them daily is because they've been taking them for years and they work for them. So what are these people supposed to do now?
Well, the estimates are that half of the people on these medications may be on them unnecessarily. So if you're on them, you want to, again, revisit the subject with your doctor. Ask, is this medication really necessary? And like with any medication, do the risks outweigh the benefits or vice versa?
And there are other medications that are less potent, right, that you might try?
Yeah, general antacid can work very well for the occasional heartburn.
Short of taking a pill or a medication, though, are there things that we can do to prevent or ease these symptoms?
Well, behavioral modifications, very easy things like stopping smoking if you smoke, lying down after you eat, which a lot of people do, not so good for the stomach and the esophagus, so you want to avoid that after meals. Loosen up your belt or tight clothing after you eat. So again, you don't have a lot of pressure in your belly, and watch your diet. So you want to avoid things like fatty foods or foods that for you trigger heartburn or reflux, because over time, all that acid in your esophagus can lead to serious problems with the esophagus, can cause ulcers. So again, you want to try to prevent the problem before you have to treat it.
It's okay that I take Prevacid, right, in pregnancy?
Once in a while, it's fine.
All right, thank you. I had to get that one in. Thank you, doctor.
You bet.
A lot happens early on The Early Show, weekday mornings on CBS.